All right, let's jump right in. We are absolutely bombarded with health advice online, right? Everything from viral diet trends to breaking news about some new study. So, how are we supposed to navigate this giant sea of information to make choices that are actually good for us? That's exactly what we're going to break down.
Just let that question sink in for a moment. We have more medical knowledge at our fingertips than any other time in human history. And yet, all that access can sometimes lead to more confusion, not more clarity. It's a crazy paradox, and it's the central challenge we're tackling today.
So, where do we even begin? Well, it all starts with a new way of thinking about a pretty old idea: literacy. The concept of just being literate has had to evolve right alongside the internet, especially when it comes to our health. Let's dig into what that really means now. It used to be that health literacy just meant you could understand the pamphlet your doctor gave you. Simple enough. But today, it is a whole different ballgame. It's no longer about just passively receiving info. Now it's about actively going out, finding it, being a detective to judge if it's credible, and then, the hardest part, figuring out what it actually means for you. It's a completely new skill set we all need. And the reason this new kind of literacy is so critical? Well, it's because of the biggest problem we're all facing. It's not a shortage of information, it's a tidal wave of it. We're living in what you could call an overload epidemic, and it's totally changing how we think about our own health. I mean, just think about your own social media feed. It's a digital jungle out there. You've got influencers swearing by a new miracle supplement, a scary-sounding news headline that blows a single study way out of proportion, and online forums filled with personal stories. They're all yelling for your attention, and a lot of the time, they're saying opposite things. And get this, our own brains can work against us. We all have biases, like confirmation bias, that make us look for stuff that already confirms what we believe. That makes it even tougher to see the whole picture. And this quote just hits the nail on the head. It perfectly explains the paradox we're all stuck in. The whole point of having all this information at our fingertips was supposed to be empowering, right? To give us control. But what happens when we can't make sense of it or it's taken out of context? Well, instead of feeling confident, we just end up feeling more anxious and confused than ever. And look, this isn't just about feeling a little overwhelmed. This confusion has real, actual consequences. The stakes for our health are incredibly high when we can't get clarity. And what's really important to see here is how these things are all linked. It's like a domino effect. If you misinterpret a guideline, maybe you don't take your medication the right way. That in turn could lead to a trip to the hospital. And if that kind of thing happens over and over, that cycle of confusion starts to wear away at the most important thing of all, your trust in the healthcare system itself. See how it spirals? Okay, so we've laid out the problem, and it's a big one. But let's not get discouraged, because now we get to the good part. What can we actually do about it? Let's build a practical toolkit that you can use to go from just being a passive consumer of information to an active, engaged partner in your own health. First up in our toolkit, demanding plain language. Now, some people think this is about dumbing down science. No way. It's actually the opposite. It's about being more precise by being clear. Saying heart attack instead of myocardial infarction doesn't lose any accuracy at all. It gains understanding. That's what good communication does. Okay, this next one is huge, and it's where a lot of people get tripped up. It's all about how numbers are presented. You see a headline that screams, "New drug slashes heart attack risk by 50%. And you think, wow, that's a game changer. But that 50% is the relative risk. When you look closer, the absolute risk reduction might only be 1%. Both numbers are technically correct, but one tells a much more dramatic story. Context is absolutely everything. All right, another key tool for your belt. Always ask where the evidence is coming from, because not all studies are created equal. The gold standard is a large, randomized controlled trial. That's the most rigorous way to prove if one thing actually caused another. But a lot of what you see in the news comes from observational studies, which can only show a possible link, a correlation, not cause and effect. And knowing that difference is just crucial. So let's pull this all together into a super simple checklist you can start using right now. The next time you see a health claim online, just stop and ask these 3 questions. 1. Who is the source? Are they legit? 2. Where's the proof? Is there solid, peer-reviewed science behind it? And 3. Does that flashy headline actually match what the study found? Seriously, making this a habit can be your best defense against a world of misinformation. So now you've got a personal toolkit, which is awesome. But this problem is bigger than any one of us.
To really make a dent in this, we have to zoom out and look at the entire system, the whole ecosystem of health communication.
And here's the bottom line. The burden of understanding shouldn't just be on you, the patient. It can't be. This has to be a team effort. Every single person in the chain, doctors, hospitals, journalists, and yes, even online content creators, everyone has a role to play in communicating clearly and honestly. And just think about what happens when we all get on the same page and embrace this. The payoff is enormous. Trust in the healthcare system gets rebuilt. Misinformation starts to lose its grip. And people, you feel truly empowered to make smart, informed decisions. It's a win-win for everyone involved. So I want to leave you with this one last thought. For a long time, being able to explain things clearly was seen as a soft skill in medicine. Nice to have, but not essential. Well, those days are over. In a world saturated with information, clarity isn't just a soft skill anymore. It is a core clinical skill. It's just as vital as making a diagnosis or performing a procedure, because it's the only skill that can turn all of this information back into true understanding.